name is Kiara, and today I will be doing my assessment. Hello, my name is Kiara, and today I'll be your student nurse practitioner. Could you please state your name and your date of birth?
My name is Randy Merchant Jr. Birthday is May 5th, 1988.
Check against the armband. Alright, today I'm just going to do a focus assessment on you. I'm mainly going to be assessing your head, your neck, and I'm going to also assess your thoracic and your lungs.
Okay.
So I'm going to wash my hands, put on my gloves. Alright, are you having any problems with headaches, any dizziness? Alright, so first I'm going to start by inspecting the head. Make sure that it's midline. I'm going to have you sit up for me. Head is midline, and it's not just, he isn't showing no kind of abnormal movements. So I'm going to inspect the head. I'm going to inspect his hair, noting the color, the texture, and noting any kind of sores, any moles, any lesions, and even previous surgical scars. Okay. And I don't feel any kind of palpable masses. The skin is clean, dry, and is intact. Alright. Next, we're going to look at your trachea. I'm inspecting the trachea, and it's in midline. I'm checking that to make sure there's no kind of, if it's deviated, because it could show that he's had some problem with it. He could have had chest surgeries or any kind of infection. Alright, now I'm going to ask you to drink a glass, take that water from me, and I'm going to palpate your thyroid. So drink some water for me, and I'm going to be checking the thyroid, and I'm going to move this over some, and I'm going to palpate the thyroid. Checking for the size, the texture, and feeling for any kind of tenderness. Does that hurt when I feel it? Alright. Next, I'm going to test your facial and your trigeminal nerves. So I'm going to have you squint your teeth up for me. Alright. Noting any kind of symmetry and any kind of abnormality. Now, I want you to squint your eyes. Open your eyes. Squint them. Alright. Now, I want you to puff out your cheeks. And I'm going to push against them. Alright, very good. Do you feel any kind of pain in your jaws?
No.
Alright. Now, I want you to shrug your shoulder. This is the spinal ascension muscle. And I want you to scrub against resistance. Does that hurt?
No.
Alrighty. Next, I'm going to palpate the lymph nodes. So we have the parotid, we have the preauricular, we have the postauricular, we have the occipital, we have the tonsillar, we have the submandibular and the submental, and now we have the posterior clavicular, then we have the deep clavicular, and now we have the supraclavicular. Alright. You have any questions for me at the moment?
No.
Alright, next we're gonna go ahead and we're gonna assess his thorax and his lungs. So I'm gonna grab my stethoscope. And I'm gonna listen to your respiratory. I'm gonna check for your respiratory rate. So I want you to breathe in and out normally, okay? Alright. Breathe in and out. And I'm just noting time. Just don't worry about me. Just breathe in and out. I'm noting the pattern. I'm noting the shape of his chest. Normally, if they have a barrel shape, they could have like issues with COPD or bronchitis or stuff like that. Alright, his rate was 18. Checking for any kind of abnormalities. Checking for bruising across the chest. Any tenderness? Alright. Now, we're going to go ahead and we're going to palpate. I'm going to be palpating your chest. I'm going to be checking for the rise and fall of the chest, and I'm going to also check the tactile thermometers. This also going to be checking to see if you have any kind of problems breathing, shortness of breath, or also it can access for if you have any kind of fluids on your lung. So I want to, can you mind laying down on the floor for me? Well, let's lay on the bed. I just want to check the rise and fall of your chest. Breathe in and out. Alright, sit up for me. I want you to breathe in and out. It's just on the side, the rise and fall of his chest. And his breathing is symmetrical, it's not labored, and everything seems to be in the right in midline. All right, now we're gonna check for tactile phonitis. So I want you, when I do this, I want you to say 99.
99.
Okay.
99. 99.
Now I'm gonna go from the back. I'm also gonna do from. Can you turn slightly that way?
Yeah.
So.
99. 99. 99.
And I'm also noting any kind of abnormalities in the sound, in the way he's sounding his voice, and if he having any kind of problem saying the words. So next, we're going to percuss your chest. We're gonna do the posterior and we're gonna do the interior. So I'm gonna do from left to right. Listen for timpani and dullness, and they usually know either fluid or any kind of masses in the lungs. You know any kind of pain? All right. Now I'm gonna listen to your chest. I want you to breathe in and out. Breathe in and out. No, I don't hear any kind of, the lungs are clear bilaterally. I didn't hear any wheezes, no stridor, no any kind of abnormal sounds. Do you have any more questions for me right now?
No.
All right, that completes my assessment.